So what I wanted to do this evening in the next half hour or so is just share a little bit about my entrepreneurial journey from as a clinician, researcher, I was a clinical epidemiologist to an entrepreneur. At once upon a time, I was just like you, sitting there, sweating over my papers and my grants. If you don't publish, you die. And now I'm just sweating over our investors. We have to get a return of investment, but it's a lot of fun. So this is me when I was 10 years old, and Julia's told you the little story. I was a bit of a minx, I have to say, and I did grow up in Ireland, in a small town called Wexford, which is about the size of Bath, where I now live, about 50,000 people. And it was quite a patriarchal society. My father always said little girls should be seen and not heard. So I really wanted to be heard, probably because I was told that for so long, which is where probably the news anchor story came from. And it was true. In Ireland, you would be either a doctor, a dentist, a lawyer, or a nun, or a priest, as the case may be. And I really wanted to actually come to Oxford, would you believe? But my father was very protective over me, and my brother was studying at University College Cork, and he said, no, you shall go to UCC. So I saw my brother 3 times in 3 years. He was a law student and a tennis coach, and when he needed numbers so he get paid by the uni, I was practicing my forehand. So I left UCC after graduating from medical school, and I went to Toronto. And it was sort of a liberation, if I might say. I love the lifestyle. I'm quite sporty, embrace the running and the outdoor life and skiing. But at work, there was a sense of academic freedom, and with my colleagues, you'd have an idea and they go, well, that's just brilliant, Millicent, you go off and do it. And it seemed like I had this license to innovate in academia. It was very, very liberating and probably a very productive time in my career. And I fell in love with ankylosing spondylitis as a rheumatologist. And I moved around a little bit, and the reasons for that will become obvious. But after a number of years, I moved back to London. I had also worked at the Royal National Hospital for Rheumatic Diseases in Bath because of my interest in spondylorthopathy. But I ended up in Guy's and St. Thomas's. Ankylosing spondylitis is a condition that affects younger people, and you get eye, bowel disorders. And so I had done an IBD fellowship and did training in medical ophthalmology and then clinical epidemiology, because I wanted to be the #1 ankylosing spondylitis clinical researcher in the world. That was my goal. And so at St. Thomas's, I was the rheumatologist in the medical iUNIT department. And I'll come back to this in a second, actually, get a little bit of dinosaurs in there. But it was an interesting journey at St. Thomas's. I loved the trust. I don't know if there's any Tommies and Guys graduates. I would think the culture overall was very good. And this is just sowing the seed for some discussion later on. There were a number of male colleagues who were slightly misogynistic, I would say. But I felt that my training and my upbringing in Ireland helped me handle that quite well. It never put me off. It might put other people off, but it never put me off, per se. Before I just make a little detour here, because we are dining with dinosaurs, and I don't know if anybody knows what this is. This is osteosarcoma of the bone, a very uncommon condition, mainly affecting children. But through collaborative work with rheumatologists, radiologists, and using up-to-date reconstructed CT scan imaging and histopathology in a true multidisciplinary team setting, they discovered this in an adult deceased Centrosaurus 77 million years ago. And interestingly, this little dinosaur was about weighing 1,000 kilograms and 19 feet wide. And one would have thought the osteosarcoma would have been the end of him, but in actual fact, it was the great floods that was the end of this little dinosaur. So I have structured this talk as a series of 4 challenges, okay? And this is to stimulate debate. I've been told that we have to stimulate debate and be a little bit controversial, so by all means, feel free to challenge. And the first challenge that I want to talk about is how when you have a change in your life, how do you have opportunities out of challenge? Now, one thing you might not know about me is this little girl here on the left is my daughter. In this slide, she was 18 months old, Grace is her name, and I was at the NIH and with collaborators, John Revell, Mark, you probably know him well, Matt Brown. We just got this really huge $5 million grant to look at genome-wide association scan in ankylosing spondylitis. I was up doing my thing presenting, and then I got a phone call, and it was a sliding doors moment where I was told that my daughter had cancer. So John Revell, lovely rheumatologist from Houston, Texas, a former priest, went into very priestly mode and gave me his credit card and said, get her out in the first flight. And neuroblastoma, I had read about it as a medical student, but thought I never really need to know too much about that. It's very rare, devastating. We were given, you know, 1 in 16 chance of her survival. So it completely changed our lives. I was living in Bath at the time. My family and I, we moved to live in New York, which is where the Centre of Excellence was at Sloan Kettering. And the costs were exorbitant, £100,000 a year for 3 years. So anybody with a maths background can figure out the cost of that. But it was constant consultations, trauma, stressful. And here was I with a background as a former academic, clinician scientist, still working on this grant with John Revell and Matt Brown and the boys. And I really found it hard to cope. And I thought, well, how does the average person manage who isn't a scientist, who isn't a doctor? And it really struck me there was a problem here in getting the right information at the right time. And if I just might make a little detour, because this problem brought a huge opportunity, even though it was the biggest challenge of my life. And, you know, in times of crisis, like after the World War, we've got the jet engine, we got radar, penicillin, and in the Jenner Institute in Oxford, you work so hard and so fast to get the vaccine out. So I would say that crisis and challenge brings opportunity, and I thought I would embrace this. It made me reflect on what I was doing at my life, and I went from being wanting to be #1 ankylosing spondylitis researcher in the world, which seemed like a very meaningless goal, to being #1 mum. And this little book was given to me by my mum, actually, and I read it, and it really resonated. And it's all about finding purpose in your life and doing the things in your life that really make you happy, and that's what you should generate your income and your life from. And in Japan, of course, in Okinawa, they have the highest concentration of 100-year-old, along with 8 other sites. And so I decided that I would decide what my mission and purpose was, and try and then all the things that I would do, make sure I did that under that umbrella. And I remember I went down to Cornwall to try and figure this with the Ikigai and about 15 other books, and I read them all in this very expensive hotel. And on the final day out, like, I still haven't figured it out. Oh my God, I've spent thousands of pounds. And then it just came to me that it was really to enable people live longer, healthier lives. It's quite simple, but that is the mission I've set myself, and that is how I judge any initiative that I get involved with. And I've tried to bring it into my work life now. And I touched on the difficulties as a mother with a child with a multiplicity of doctors with a very serious condition, and how hard it was to get the right information at the right time. But when I went back to work, I only took a few weeks off. I noticed how hard it was for patients, my patients, to have the right information. They were losing pieces of paper. You know, when I particularly was at St. Thomas's as a rheumatologist working in the eye unit, we'd have 90 patients on a Monday afternoon, and all the hard ones came to my desk for biologics, and there was no information. There was constant risk, constant complaints, and I really wanted to innovate around this. And I felt that the core issue was I could help people live longer, healthier by simplifying this complex web of communication in the healthcare system, a lofty goal to aspire to. And iOWNA really is a very simple idea. It's a digital platform that enables clinicians to exchange information for patients. I'll explain in the next slide a little more. But we have come a long way, and I would say we are a cross-disciplinary healthcare team of leaders, clinicians, entrepreneurs, many of whom have academic, research and entrepreneurial background. And I think that's fundamentally important that I didn't just walk away from my academic and my clinical background. I've brought it with me on the journey, and it's quite powerful. So if you ask me to describe iOWNA, I would say it's like the Microsoft operating platform for nurse clinicians. It's really the rails on which they can transform their clinical practices, and it saves a lot of time, up to 60% of chronic disease follow-up appointments. And in one hospital at Milton Keynes, where their CEO happens to be the head of NHS England Digital, we've been able to show enormous savings in inflammatory bowel disease pathway, which of course is interconnected with rheumatology. And when we modelled up the savings that we would make on a national level for 5% reduction in nurse time, and bearing in mind we save 60%, it was 320 million a year. That's massive. So it's a very simple to use little tool. We can capture proms, which is how we live and die in rheumatology. You have this asynchronous two-way communication, because our doctors and nurses said, if you allow the patients text us all the time, we're not going to use it. So we have the ability to get feedback from patients in a structured way. And of course, security and evidence base for what we're doing is absolutely vital to me. I would actually describe what we're doing with iOWNA as, if you think about this as a little box, we've made up this pretend statin, and on the box is a QR code. I'll pass this around, the link to iOWNA, because my vision is every patient who has chronic disease, of which there'll be 50% of the population, we don't have the resources to help them. There's going to be more and more reliance on digital pathways, but we need a reliance on evidence-based ones. So this is going to be the digital companion to treatment pathways to help people get on the drugs that are needed for them, make the necessary lifestyle change, have the better clinical outcome and better experience, whilst also leveraging very valuable clinician time. So second challenge is, how do you do a job that you're not trained to? Many of you are probably looking for jobs when you graduate from university. Many of you are in jobs that you probably were never trained to do. Well, I would say entrepreneurship is a good answer to that question. And would you believe, I had to get this little Irish connection in, but the father of entrepreneurship is a chap called Richard Cantillon. He was born in County Kerry in the late 1600s and emigrated to Paris, where he set up and run a bank. He was very entrepreneurial in his dealings with the Mississippi Holdings, where he loaned people money to do investing in Mississippi, and did a lot of investing himself and sold just at the right time. But unfortunately, his colleagues weren't so lucky, and it was pursued vigorously later in life. But he did write an essay on economic theory and defined entrepreneurs, among other things, as risk takers. And I do think you need to take risk. I took a risk leaving an amazing job at Guy's and St. Thomas's to actually pursue my entrepreneurial adventures outside of the NHS, because it was quite hard to innovate inside the NHS. But I was not foolish enough to think that I could actually be the CEO of a company. We were able to raise large sums of money, because I, had practice with grant writing, and writing business plans isn't that further away. So I thought I better study what entrepreneurship is. And I went to the other place in Cambridge and did a 2-year MBA degree in entrepreneurship. And I have to say, absolutely loved it. And I did think, why didn't I do this first time round? But actually it was more meaningful now, because I was bringing together the strands of my experience in all the different disciplines I've shared with you, and also my life experience. And I have to say, it was a very happy time. And now I have a whole load of 25 and 26-year-old best friends. So it's very rejuvenating. But I haven't really forgotten my roots. And I did mention that one of the things that's really important to me is that there is evidence base around what we're doing, because there's a lot of early stage ventures and long established commercial ventures who'll say, well, we have this great tool, it does X, Y, and Z. Do we really know if it does X, Y, and Z? Well, we're actually planning a clinical trial in a couple of disease specialty areas, and I would love if anybody here was interested to join us. to generate the evidence. And I'd like to take this all the way to a prescribed digital therapeutic. But it's not enough to stop there and get your publications. We want to have impactful change and disseminate our results so we really can change. And this was one of the reasons that I applied for the Royal Society Entrepreneur in Residence, which I was very fortunate to get and started in January, based at the University of Bath at the Centre for Therapeutic Innovation, which is a cross-disciplinary entity, a centre at university level. And what I'll do there is, in the first year, when I was in Cambridge, I was sent to a college that I didn't perceive to be very fancy, and I was a bit disappointed, but they did have this Changemaker program, so I thought, well, I'll embrace what Homerton have to offer. And it was transformational. So I did this podcast on how to live a longer, healthier life by embracing the arts. And I interviewed lots of artists and scientists who were artists and doctors who were artists. So I'm going to take my podcast days back and set up a new one to interview people involved in the entrepreneurial journey, from literally in the laboratory where you have the kernel of an idea, to a venture capitalist, to a Nobel laureate, to the person on the street who benefits from these innovations. And then some of you may use this cool tool called Slack. We use it in our tech company, where you can communicate with each other. And I thought we should adapt that to facilitate and enable cross-disciplinary research. So that will be second year. So I just thought this was quite nice, because one of the missions and strategic vision of the Royal Society is to bring science and the humanities together. And of course here we're at the home of humanities in this amazing university. And I love this quote that Callum, who works with me, who's a humanities scholar himself from Oxford, gave me, is that life depends on science, but the art makes it worth living. And certainly art is something that I've embraced in my life. So there are challenges as a woman in the workplace. There's challenges for men too. But I thought I would cover this topic, and it's something that you might like to debate in your tables and ask me further. I would first like to say that I've been really lucky in my career, and we'll talk about luck at the very end. And the people who've actually supported me the most in my career have actually been male mentors. I've never had a problem with any female mentors, but the men have really helped me, and I feel very lucky for that. I've probably had only one or two not so optimal experiences, and I was telling Callum a few stories that I'm happy to share later. But on the whole, I would say that men have been good to me. But there are challenges as a young mother trying to have an academic research career, let alone a business career with young kids. And my first consultant post when I was in Toronto, I applied to go back to Ireland, and it was a job sharing post because there's no jobs in Ireland for rheumatologists. And I went for this interview, and my job share colleague, male, decided he didn't really think I fitted the bill for him, which is, you know, a personality thing. And he said to me, you know, when they do the interview at the end, can you make sure that when they say, if you have any questions, you say no, but I just want to tell you one thing. And I said, oh, what's that? He said, well, when they say, if you have any questions, just say, I just want to tell you I had a baby 10 days ago, which I had before this interview. And I wonder if I can take plenty of time off to look after my baby. And I said, but I'm actually very happy to work full time. He said, no, that will get the job. Anyway, I didn't get the job. Years later, a lovely lady came up to me and said, don't you ever say something so stupid in an interview again. So it was a lesson learned. But having said that, I do have lovely male colleagues that I go running with to counteract stress. And I'm a big fan of my fellow colleagues. But we can't get away from the fact that there are gender inequalities in society. And if you look at the Equality and Human Rights Commission report from 2016, you know, 77% of mothers have a negative experience around childbirth and breastfeeding. And I've just shared one little story that I had. It probably was an opportunity, because had I not asked that stupid question, I wouldn't be standing here today. And 70% of all NHS staff, you know, make up women, but yet only a fraction of them are in senior posts, 37%. Now, why is that? And if you take it to the world of business, I think the next slide illustrates it beautifully, a cool piece from The Guardian, that 7 women in FTSE 100 companies are in leadership positions. And this is quite cool that 14 of the men in leadership positions are called David and 17 John. How many Davids in this room? How many Johns? Okay, cool. Anyway, I digress. But I think the point is that it's how you approach the chat. There are systemic inequalities. And I'm thinking that maybe, sorry, I'm going backwards here, maybe my entrepreneurial attitude, maybe my upbringing in Ireland, and my father, who was a very patriarchal, helped me cope with that. But things are changing, and it's up to you, the future, not to be put off and to follow your dreams. Coming on to the 4th and final challenge now, the challenge of partners. Now, this is a very common entrepreneurial story in that I set up iOWNA with this lovely man called Adrian, who was my fiance at the time. And we went for a trip to iOWNA because my idea was that iOWNA is synonymous with longevity. It's where the High Kings of Ireland and Scotland were buried, because I thought they'd get to heaven quicker. And unfortunately, it wasn't a marriage made in heaven for us. And Adrian had been Chief Operating Officer, super bright guy at the Prudential Insurance, big company. So he rang all the business, and I did all of the innovation and the creation. And I did, at this time, go back to Cambridge to learn a little bit of theory. But anyway, he decided that he would leave and go to California, and he left and took the entire business crew with him. And I was left alone with Mother Teresa, praying what in the name of God I was going to do. This picture was also taken in iOWNA, actually. But what I did was I talked to people. I thought, I can do this. I was terrified, to be quite frank. But I assembled an amazing team around me. And, you know, I thought, okay, what do I need? I need finance, I need tech, I need human resources, I need somebody, life sciences, somebody who's going to be running the commercials. I need an advisor for digital transformation. And over the course of the year, I tapped my network, and I brought on Lou Carton, who's Chief People Officer, to help me pick these people. And actually, one of our delivery team is Callum, who's here, who helped me think about this talk and what might be interesting to you today. And he's a double first from humanities from St. John, and he seems pretty happy to work in the company because we're trying to change things and do meaningful stuff. So think about your partner if you're thinking of a spin-off, and make sure you write the prenup before you do the founders agreement. And that is a thing, by the way, with your founder partners. You should be doing a pre-op. You should be thinking what happens if you break up in a commercial relationship. Other partners, of course, are customers, and the NHS is a big customer of ours. I'd like it to be bigger because I feel really guilty having left Guy's and St. Thomas's and the NHS to innovate, and I'd like to give back. But there are so many challenges in the NHS. You know, we need to be digitally transforming and disrupting. Manpower, you know, waiting lists. There's 9 million people waiting to be seen. But I can tell you the roadblocks to try and penetrate the NHS, even though I have a medical board full of full-time consultants. I spent all my career in the UK in the NHS. It's fragmented. The tech departments block us. Governance, even though there's a centralized format, it's different at every hospital. Finance block you. And yet, as I shared with you, for one simple little innovation, we've shown we can save the NHS £300 million. So what do ventures do? They turn to pharma. It's a constant rhetoric. Oh, I'll make money from pharma. And pharma have a need because 50% of patients don't take their medication as prescribed. That's bad for patients. It's bad if you're a pharmaceutical company. And 30%, 40% fail to take them at all. And so iOWNA does address this issue of adoption, adherence, and compliance, but, you know, in an ethical way, and I'll come to that in a minute. But when you're working with pharma, as slow as the NHS is, pharma is fast. You've got to be super agile. You've got to adapt. And a project came in with a commercial partner that wasn't a pharma company just last week. And luckily, we had quite an agile approach to how we would create a proposal for them, which is adapted from McKinsey. And I think it's really important to build systems in. You shouldn't rely on one person in a company. You need to have system and process. And that's one of the things that I think management school taught me. But of course there are ethical considerations. You know, you go to the dark side, but you have to be very careful. I mean, we know that 1 million people died since 1999 from the opioid crisis. You've stripped their names off the building, the Sackler family. So it's tempting to go into lucrative partnerships, but I would say necessary also. And you know, we have an example of Tiny Maney and Mark's group, and they have revolutionized the care of rheumatoid arthritis. So eyes wide open, and so long as you feel aligned in your mission, vision, culture and values is the key thing. So how do you pick the perfect partner? Well, I'm sure many of you, when you want to have a date, you go on one of these dating apps. I'm far too old and too much of a dinosaur to have done them, but you would put in, you want somebody, I'd put in somebody who was, you know, dark and sporty and handsome or whatever. And it's the same when you're looking for a partner to work with. We should be choosy. We should be choosing our partners. And I now think, okay, who has the vision and culture alignment? Who's going to operate in an ethical way? Because as a doctor, you get one reputation and, you know, you lose it and that's it. So we've got to be really careful. And we have the highest form of ethics, I would hope, because of our concern with patients. The timing has to be right. It's got to work financially. And you have to have a solution or be able to come up with one that fits the need. And there has to be room for growth on both sides. So I thought I would close with 2 final slides on some good luck tips, because when I was a little girl, my dad used to say, you're so lucky, if you threw up a penny, a fiver would come down. But are we lucky, or do we make our own luck? And I don't know if anybody knows this story, but way back in 1984, there was a lawyer sitting in the balcony of a very famous trial in Mississippi of a little girl at age 10 who was raped. And he sat there thinking, oh my God, this is terrible. And what about her dad? If I was her dad, I want to kill him. I wouldn't care if I go to prison. I would kill him. And of course, that was John Grisham. He had the idea, he ran with it, he's Time to Kill. He sold 250 million copies of the book. Everybody else was there also, they heard the same thing, but he's the one who had the idea and he's the one who acted on it. And I thought I'd give you a little roadmap for how to evaluate opportunities. And of course, in management school, it's all 2x2 tables, guys. So if you look at the opportunities, you need to reflect them to the outcomes. And you think, okay, did you avail or did you ignore an opportunity? Was the opportunity a success or a failure? Because there are opportunities that you should walk away from. We talked about ethics. Maybe it's a bad deal. Maybe it's going to make you go out of business. And so I find this quite a useful little table to have on the back of my mind when an opportunity comes in, or maybe we fail at that opportunity. It's often an opportunity in disguise. And this is one of my favorite all-time books that I'm going to finish on. And it was given to me by a rheumatologist called Dr. Ram Ramanandram, who did that seminal work on tocilizumab for rheumatoid arthritis pediatric patients. And Ram gave me this because he's a pretty lucky guy. And it's written by Ashwin Sanghi. I highly recommend it. And it's all about, you need to create opportunities, raise them. When you raise them, respond to them. You need to recognize them. And these are the 13 steps. You know, we've all done the networking. You have to listen to the little voice inside your head. But the one I'm going to pick out and close on is confidence. Because I think one of the reasons why I have been able to make brave steps, maybe, you know, take my daughter to America, is that why she survived? Who knows? Leave the NHS and set up a company. That requires risk, and you have to be confident that and secure that these things are going to be okay. And you guys need confidence as you head out into the world. But Warren Buffett used to be a very quiet, shy man, and he's obviously a global superpower, richest guy, huge philanthropist. But he took himself off to Carnegie school to train in confidence and did a year's training in confidence. And now he learned how to play the ukulele. He sings and dances at the office parties, always stands up for the town hall. So I would say my number one thing here is to say to you to have confidence in what you believe in, what you stand up for, and what you're passionate about, and go for it. Thank you very much for listening.